My name is Tony Gasparis. I'm a vascular surgeon and the director for the Vein Center here at Stony Brook. And I'm going to show you today a diagnostic tool that we use to evaluate patients with edema or leg swelling. It's made by Delphin Technologies and it's called the LymphScanner. So the LymphScanner allows you to measure water content in the tissues in a local area, and it has two values. One, it not only is a diagnostic to help see how much water content is in the area, but also is a good tool to follow patients after treatment or intervention to see how their leg edema or swelling improves. And it's more objective than rather just pushing on the leg and looking at the leg. So this is Richard, and he's an 86-year-old gentleman with, as you can see, significant venous disease in his lower extremities. He has extensive edema in both legs with skin damage. Yeah. If you look a little bit closer here, you can see there's a lot of pigmentation in the skin. And if you push down on his skin, you'll see he has pretty extensive edema, pitting edema, with indentation here. So this is the LymphScanner that I was mentioning, and it's a diagnostic tool that allows you to be able to evaluate the patient's subcutaneous tissue and see what amount of water content there is or how much edema, how severe the edema is. And you can not only evaluate that, but you can also compare it to a normal area and see how much excessive water compared to, let's say, the upper extremity there is. So by clicking on this button, you turn on the device, and you can see here there's two modes. There's a spot mode and there's a scan mode. If you click the button once, it'll get you to the spot mode. If you want to switch back to the scan mode, you hit it again and it switches over to the scan mode. So with the spot mode, it allows you to evaluate only one isolated area versus the scan mode where you, like I mentioned earlier, you can compare, let's say, the upper extremity to the lower extremity and get a ratio. So we'll start off with the spot mode, and what this will do is it'll give you a percent water content. So you want to measure the area usually in the same spot. So in the lower extremity, we usually go about 8 centimeters above the medial malleolus. 8 centimeters above the medial malleolus is about 4 finger breadths, and it gives you a reading of 57.4%. So we have 57.4% water content in this area. Now the device will let you know if there are enough force application to the skin in order to get a reading. If you have too much force, it'll give you a notification. High force, if you're not having good contact with the skin, it will let you know that you are at low force, and you have to reposition or readjust the amount of contact you have with the skin in order to get a reading. As I mentioned earlier, you can go in the scan mode and compare percent water content from the normal area, the upper extremity, to the leg, and that will give you a ratio. So again, as in the lower extremity, you want to do the measurements always in the same spot. So in the upper extremity, we typically go below the antecubital space, about 5 centimeters, which is 3 finger breadths. We position our LymphScanner, hit the button, and that stores your reference point, which is 29% water content. Once you have your upper extremity or reference point reading, we then move over to the lower extremity. And again, as I mentioned before, you want to go to the same spot usually, which is about 8 centimeters above the medial malleolus or 4 finger breadths. And you position your LymphScanner to get your lower extremity reading. So in the lower extremity, you can see the top number there is 63, so percent water content is 62, 63. And your ratio of upper extremity to lower extremity water content is 2.08. So your ratio really, like I mentioned, compares what the water content is in the lower extremity compared to your reference point, the upper extremity. So if the ratio is 2, that means it's twice as much. If it's 1.5, then it's 1.5 times the water content of the upper extremity. So this gives you a good indication of how much excessive water there is in the subcutaneous tissue compared to a normal area. A recent paper of expert opinion on lymphedema basically mentioned that physical examination is a good tool to evaluate patients with lymphedema. But they also mentioned that an objective way of evaluating that edema is equally as important. And what the LymphScanner does is it allows you to provide objective measurements of how much swelling or edema is in the patient's lower extremities. Now, the value of this tool is twofold. One, not only in a diagnostic perspective as far as looking at how much edema is in the tissues, but also as a follow-up tool. So once you've evaluated the patient for the first time and you see the amount of edema that is present, following treatment, whether it's compression stockings or venous interventions, you can follow the patient using the LymphScanner to see how the improvement of edema occurs.